So let's dive into these strategies. What if you could study without feeling overwhelmed or feeling stuck? So the question that you want to ask yourself is, how can I study in a way that it makes it easier for me to understand and to be able to confidently pick the best answer on the exam, all right? So every time you're studying, you're like, how can I make this easier? How can I confidently pick the best answer on the exam? Well, it is possible because people have done it. So here's what you can do. So I always do guide people in terms of anatomy. So the test is divided into four. So take a look at my fingers, right? So I always use my fingers to describe this. So the domains are broken up in a certain way. So you have to know, and I always go down to the bottom, it's my pinky. This is general knowledge. So it's one domain. The fourth domain is the general knowledge. And then it's evaluation, prognosis, and treatment, right? Those are the four domains. And the reason why I always start with general knowledge is that is anatomy. That is the foundation of which you build everything else. So you have to know your anatomy. You have to know your hand anatomy, your wrist anatomy, your elbow, your shoulder, and even your neck too. And then all the nerves that go down, right? So somebody was asking me like, that you're struggling with anatomy, shoulder and hand. Well, that's pretty much the whole arm, right? Pretty much a whole arm because everything is connected. You have to study and understand the anatomy because it's foundational. So when you study that, you will then be able to problem solve through your evaluation. So that's domain number one. So if you understand anatomy, you understand how things move and then how things are broken, right? Fractures, lacerations, complex injuries, compressions, anything like that. When you understand normal and you understand abnormal, then you can start to problem solve through evaluations and then prognosis. Prognosis comes down to like, how do you progress someone? When do you progress someone? And those are your quote unquote protocols. And it is not always studying to memorize these protocols because it is, again, confusing when one protocol book tells you to do it at 2 weeks and the other protocol book tells you to do it 3. And even within the book, the chapters might tell you something different because they're written by different people, right? So that's the confusing part. So how do you make it easy for yourself? You have to understand the foundations of it so that you can understand how to problem solve through. And then because you know foundational knowledge and because you know how to evaluate and because you know how to kind of plan for success, right? Then it's applied knowledge treatment. What would you do as a certified hand therapist for the best possible results? So number 3, applied knowledge and treatment is the key to passing. It is applied knowledge. The way the CHT exam does it, it's that so that you can become, you have to become the critical thinker, problem solver, and decision maker, right? So I always say when you become a certified hand therapist, you become the critical thinker, problem solver, and decision maker because you are an expert in your field. You don't have to sit there and constantly wait for a doctor to tell you what to do, right? They do well what they do, which is to do surgery, to give injections, and to dispense medication, right? You as a certified hand therapist, you know what to do when they come in with certain things. Now, I'm not saying it as a way of being disrespectful to doctors. I actually am saying it as a way of being very respectful to them because they know their part and they rely on you as a certified hand therapist to tell them your part, right? And so you constantly want to think about that. What would you do as a CHT for the best possible results? And it's really about picking the most important aspects to know and then applying your knowledge. So if you're going on YouTube and you're, just watching a ton of anatomy, it can be really confusing because they include so much more. They include so much more than you actually need to know. So the way my program is built, everything is through rehab of the hand and anatomy is through. So what do you need to know as a CHT to make the best possible, treatment recommendations? What do you need to know so that you can evaluate them correctly? What do you need to know so that you know the protocol that they're supposed to go through? So you're supposed to be able to answer any question that comes your way. You can't just study like one subject and hope and pray that that's the subject that they're going to ask you for, on the exam. Right? So that is essentially what you can do. So the other thing to then take that knowledge of what you can do, right, is now here's another set of strategies is really how to carry it through. You want to chunk up your time to study. Like, I know you're busy, you're all working, you all have kids, you all have families, you have friends, you have things that you want to do, right? And it's not always studying for the exam. Like, I get it. So the key thing to ensuring that you sit for the exam and not, and cut through your study time in half is that you need to chunk up your time to study. And then you need to chunk up your topics and your chapters and your study questions. So for example, we'll talk about it a little bit more when we go into the planning, but I go, August 3rd is going to be our first Tuesday call in the 12-week hand exam prep program. So I go into hands for 2 weeks, right? In those 2 weeks, you should already have gone through some of the topics, some of the chapters, and some of the study questions and chunk that information up into hands, everything related to hands, right? And then how do you think through all those types of hand problems, right? And then we go through it all the way through all those topics. So you can do that too. Chunk up your topics, chunk up your chapters, chunk up your study questions. And that's one way of getting organized. But another way of getting organized really is to a certain extent, you have to understand how you study, right? I'm a writer. I have been telling people for the longest time, get your paper, get your pen. You don't need anything fancy. But there is so much research that talks about how much you retain, right, in terms of understanding and stuff like that when you pen to paper, because there's something kinematic about like actually writing stuff down. Now, some people, they do everything on the computer and everything like that. They take their notes on the computer, they read on the computer. If that works for you, then you know that works for you, right? I know for me that doesn't work. So get organized, get it fast, and figure out what works for you, right? Write it down, schedule yourself out. Is this helping you guys at all? Then type into the chat, let me know it's helping you. And I'm going to go over some more questions and stuff like that